Flu cases on the rise across the country. Thank you for staying with us. I'm Glenda Lewis.
And I'm Simon Shakett. Great to be with you. Right now, people are going to the doctor for flu-like illnesses at record levels, the most in 15 years.
Michigan, among a dozen states, reporting very high flu activity. Look at this map from the CDC, and you can see that very high level indicated in purple. Our chief health editor, Dr. Partha Nandi, joining us now. And Dr. Nandi, when does the season peak, and why are we purple?
Yeah, it's kind of crazy, right? So I've been a rough respiratory season now, and I know lots of patients and even family members who've come down with the flu. And the CDC reports this, that at least 24 million flu illnesses, 310,000 hospitalizations, and 13,000 deaths from flu-related complications. Now, this year's flu activity is the highest we've seen since the 2009 H1N1 pandemic. And the season typically peaks, as you asked me, for between December and February, but cases are still high with no signs of slowing down. And since flu activity can rise and fall, it's possible we'll see a lot more cases in the coming weeks. Not good news. Unfortunately, hospitals are seeing more ER visits, and some schools have even closed, including here in Michigan. Latest data shows that Michigan has 5,531 confirmed flu cases and 8,635 flu-like illnesses, and nearly 8% of patients visiting ERs and urgent care facilities had flu-like illnesses, a big jump from 5.4% the week before. And nationwide, more than 31% of flu tests are coming back positive, up from just under 19% in late December and early January, according to the CDC. Now, testing is showing this, that two strains, type A H1N1 and type 3 H3N2, are causing most of the cases.
So what are flu vaccination rates, and what about prevention?
Yeah, so again, not great news, right?
Yeah.
Flu vaccination rates, Glenda, are still low in Michigan. And so far, about 2.6 million Michiganders, just 24%, have gotten their flu shot. And according to the state health department, not enough, in my opinion. Nationally, flu vaccination rates amongst kids have dropped to around 45%. Which is a lot lower than usual. As for prevention, right, we talk about this. Please wash your hands often with soap and water. Avoid touching your eyes, nose, and mouth. Cover coughs and sneezes with a tissue or your elbow, the crook of your elbow. If you're in a crowded indoor space, wearing a mask can help reduce exposure. And most importantly, please, please, please get vaccinated. Since flu season is still going strong, getting vaccinated now can still protect you. And while it isn't a perfect match, right, nothing in life is, it's still one of the best defenses we have. If you end up with a flu-like symptom, then call your doctor, urgent care, or pharmacy to ask about testing. There are also at-home flu tests now, Glenda, available. If you test positive, start antiviral medication early, and that can help shorten symptoms and lower your risk of complications. Also, if you develop severe symptoms, and those are like trouble breathing, chest pain, or high fever that won't go away, please get help right away. Flu season isn't over yet. So taking precautions now can make a big difference, and people die from this. Mm-hmm. And then you may be okay, but if you give it to someone else, and they could, especially an elderly or immunocompromised person. So it's an important consideration to get vaccinated and get protected.
Yeah, don't forget about it. Thank you, Doc.
My pleasure, of course.
Good to see you.
Same here.
If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or X. We'll get it right to him.